sa inyo. So, just a brief background. So, EMG and CV. So, EMG is electromyography test. It is used to test muscles, and also NCV is nerve conduction test. So, I'm the one assisting for now sa ang procedure. So, for now, naka-seriously na tanan. Pero, ano lang, I'll be discussing about isometric exercises. Okay? Sige. Okay lang mo. So, may ginawalat ako from St. Paul's, Yapon. Sir John. Sir Jay.
Yes, Miss. 3 students po Miss, na wala pa.
Yes. Okay. So far, wala man ka mo nabudlayan through online internship? Anyone from the group? Hello. Okay, sige. Just lang man, ang ata lang man sa boundary sa internship ninyo through online is more likely a review na lang din or application sa mga natunan nyo na mga theories sa school. So probably ma-focus kita clinical setting rather than sa theories or sa books. So hopefully ang questions karon is more likely linked man sa clinical setting. Okay? If confused ka mo or later on, pwede man ka mo ka-message sa amon or sa akon later on kung gulayan din ka mo. Okay? Just contact niyo inyong PIOs and I think sila sa amon contact. Okay? Sige. Sir J, wala pa sila Japon?
Hindi na-contact naman, Miss. Pero pwede man to proceed na lang, Miss. Or Miss, is there a possibility na pwede ma-record ang meeting or ang class?
Hatag ko man ako ng presentation later on. And then, kung ma-absent sila for today's lecture, please sambala lang ang contact ng ilang in charge na CI. And then, hatag lang sa space nila ng letter. Okay? Sige. Okay, sige. Proceed na lang kita. So, makita niyo guys.
Yes.
Okay. So today we will be discussing about isometric exercises. Actually, very short lang siya topic. Just a quick review kung anong isometric exercises. And then later on, discuss natin paano na siya ginaubra sa rehab setting. Okay? So isometric exercises, what is it? So isometric exercises is a static form of exercise in which a muscle contracts and produces force without an appreciable change in length of the muscle and visible joint motion. So probably it is a resistive exercise na wala ang nag-change ang length or ang iyang distance sa atang muscle. So next, it is an isometric resistance training which became popular as an alternative to dynamic resistance exercise. Okay? So, also, it is associated with repetitive isometric contractions. Okay, next. So, what is the rationale for using isometric exercise? So, loss of static muscle strength occurs rapidly with immobilization and disuse. So, it estimates from 8% per week to as much as 5% per day. So it has been suggested that muscular endurance plays a more important role than muscle strength in maintaining sufficient postural instability and preventing injury. So ano pala siya? So what are the types of isometric exercises? So muna siyang ginagamit natin sa rehab. So we have examples man sa kada isa. So first is the muscle setting exercises. If you're familiar with quad setting, ham setting, gluteal settings, these are muscle setting exercises. Next is for stabilization exercises. So most likely stabilization exercises is used for postural naton nga mga exercise. Okay? And lastly is the multiple angle isometrics. So ang focus ko lang within the multiple angle isometrics is most likely sa shoulder. Actually, ma-apply naman siya sa iba ng muscle, pero ang very common na ginagamit din naman is ang shoulder nga joint. Okay? So karon, kita ko karon sa inyo how to do those yung mga exercises. Okay? So next. So for muscle setting exercise. So muscle setting exercise is an isometric exercise which is used to decrease muscle pain and spasm and to promote relaxation and circulation after injury to soft tissues. So muscle setting exercises is mostly used for acute na injury probably or post-surgery ng mga cases. So next is this. Actually, this does not improve muscle strength except in very weak muscles. So when we use muscle setting exercises, probably it is used for acute na mga muscle na mga, like for example, atrophy, or this is probably used for to prevent ang further na pag-atrophy sa muscle. So, yes. Again, ang dagkuman, ang example sa muscle setting na exercises are the quads, hams, and the gluteal settings, which will be included sa inyong clinical exam later on. Okay? So, okay, let's proceed. So, stabilization exercises naman. So, another isometric exercises is your stabilization exercises. So, stab exercises is to improve postural stability and dynamic stability of a joint by means of mid-range isometric contractions against resistance in anti-gravity positions and in weight bearing. Okay, so stabilization exercises is important to improve postural stability. So probably if nag-improve na ang imong muscle through muscle setting, pwede ka naka-proceed with stabilization exercise. Okay, so next. So other use for stabilization exercise are for rhythmic stabilization and alternating isometrics. Okay, so later on, kita naman karon kung paano umbrahon ang mga classic exercise. Okay? So next is your multiple angle isometrics. So bali ito, lang siya, level 1, level 2, and level 3. So this one, multiple angle isometrics, based man sa iyang name is multiple angles, so meaning the increase or the change ang iyang range. So resistance is applied manually or mechanically at multiple joint positions within the available ROM. Okay. So maybe the goal for this exercise is to improve strength throughout the ROM when joint motion is permissible. So from time to time, you increase ang imong joint and then ma-apply ka resistance and then amat-amat increase sa available na pain-free na range of motion. So mo na siya dapat ang aton nga i-consider. Supposed to be when we go to multiple angle isometrics, dapat make sure naton na pain-free na ang aton nga range of motion na ginaubra sa patient. Okay? So, next. So, for summary, sa tanan, isometric exercises. Isometric exercises is to minimize muscle atrophy when joint movement is not possible owing to external mobilization. So, For example, kung bago ba lang si patient na surgery, probably ginakas na siya or probably immobilized na sa katanga or mo siya contractures. So probably pwede kita ka-advise for isometric exercises which would go to inyong muscle setting exercise. To start kita sa muscle setting exercise and then amat-amat improve. Okay? So what is the use for isometric exercise? It is to activate muscles to begin muscle re-establish of neuromuscular control but protect healing tissues when joint movement. It is not advisable after soft tissue injury or surgery. So, nag-inambal ko na it is used for post-surgical treatment. Okay? So it is also used to develop postural joint stability, and this is most likely for your stabilization exercise. And to improve muscle strength when use of dynamic resistance exercise to compromise joint integrity or cause joint pain. So when you do isometric exercise, do initiation siya sa muscle to contract. So, probably, ga-improve ang aton or ga-initiate siya sa muscle strengthening. Next, it is to develop static muscle strength at particular point in the ROM consistent with specific task-related needs. So, pwede mo siya gamiton with task-related activities. So, pwede ka i-promote mo with mga OT activities. Okay? Okay, so factors na nag-affect sa isometric training. So first is your intensity of your muscle contraction. So intensity, so ang aton ginagamit mainly as PTs is ang aton na strength ng gid or manual strength ng gid sa PT. Okay? So, pwede ta i-adjust according lang sa makaya man sa patient. Hindi naman pagpipigulpihan na pabugatan ang patient when it comes to intensity. So, intensity of muscle contraction, kung manual, is probably dependent sa force na ginhatag sa okay, for the duration of muscle activation. So, very common talaga siyang maneuver, bisan wala ta pa ni-discuss, is kita ginatawag na 6 seconds hold. So, probably ang contraction na ginagpahita natin is probably 6 seconds hold. So, pwede pa na siya actually ma-increase from time to time, pero ang max na ginatan na makubra is for 10 seconds hold. Okay? And then, may ginatawag kita nga muscle fatigue. Okay, for repetitive contractions, so very common ang standard natin is 10 repetitions. So, we can start with 10 repetitions or according lang sa makaya-anay sa pasyente. Next is joint angle and mode of specificity. So, pwede kita like kanina kung mag-amat-amat kita improve sa multiple angle. So, pwede ta na siya nga ma-increase, like start ka anay sa, let's just say, sa 30 degrees, tapos amat-amat increase with 60 degrees, and then increasing pa kato sa full range of motion. Sama siya sa joint angle mode and specificity. Okay, for the sources of resistance, we depend most likely kung manual is sa force na ginhatag sa PT. But I think na-discuss mo sa inyo with Sir Joseph ang ato na ginatawag na dynamic na mga resistance training which includes your PREs like mga dumbbells, ang inyong mga ankle weights. So, dira na siya makato. So, pwede ka ka-progress gradually increasing sa weights na ginhatag nato sa patient. Okay? Okay, so let's go with quad setting. Okay, when we do squat setting, so ang muna siya next yung practicals. So, First, is you position the patient. Pag gusto ka, pwede siya long sitting, pwede siya supine. And then, you put a towel sa likod sa iyang tukod. And then, you ask the patient to contract or to push ang towel downwards. Make sure na na-contract ang iyang quads. So, you hold this position for 6 seconds and then you repeat the process for about 10 repetitions. Okay. So, any questions, Leonard? Any questions from the group? Okay. So what is ask ko? Tawal ang ibutang na hindi bowl. Mas advisable na tawal ang binubutang pag hindi bowl. Hello, Pusigatanan.
Yes, can you repeat the question, Miss, please?
Mas advisable na ginabutang ang towel rather than ang ball na pala.
Kaya may tendency, Miss, nga ang bola, madakyos, Miss, hindi siya bala, Miss, stable. Unlike nga ang towel, Miss, medyo haba siya nga hindi, Miss, tuwas-tuwas ang tinisang patient.
Yeah, so probably kung ball naka-standard siya na size. So, probably hindi siya maka-execute sa mayos ng quad setting exercise or yes, probably ang chances na mag-slip siya from sa iyong mga tuhod sa patient. Okay? So, paano mo mahambal na sakto ang ginuubras ng patient? Anyone from the group kung mag-quad setting exercise?
Permission to speak, Miss.
Ano?
Permission to speak, Miss.
Yes, go.
Si John. Miss, kung gasa kang iya patela.
Kung isa ka iyang patela. Okay. Actually, kung sakto na, sir. And then, basta mag-amo na niya siya, naka-position na si patient, and then gina-contract yan ng iyang quads. Tapos, or for example, kung covered ang iyabe, habang naka-pants di si patient, wala siya naka-shorts. Okay? So, hindi mo makita ang patela. So, don't hesitate to ask for permission na kaptan mo ang iyang sa quads na area. So, make sure nga nag-contract ang quads na area. So, you have to hold that position. You instruct the patient na, sir or ma'am, kindly push down ang towel downwards towards sa bed, and then you hold that position for 6 seconds. And then, kapten mo, make sure nga palpate mo mayo, and then once you contract, sakto na siya ginapaugnay mo sa patient. Okay? So actually, the other leg, pwede mo siya straight man, ang opposite nga leg. Pero guys, hindi niyo pwede ilungan ang duha ka tail. Okay? One side at a time lang magpa-contract sa quad setting. Okay? Sige. Any questions sa quad setting? Clinical questions? Okay, proceed ko ha. Okay, next is for your ham setting. So, this one is for your contraction naman sa hams. So, pwede ka ka-position sa patient, supine, or long sitting. Okay? So, ang imo naman, may resistance or ang imong towel, libutang mo diri sa may heel, dapit, and then, pwede slightly bend, pero not fully bend, ha? Ang inyong hams. And then, you ask the patient to push mangyapon down towards the bed ang inyong towel. Okay? So, same man na 6 seconds hold with 10 repetitions. And then, if nakapants or hindi niyo makita ang contraction, make sure to ask permission from the patient na ipalpate ang hams niyo ng muscle. Okay? Any questions? Okay. Alam sila. Good. Next. Okay. Lastly, for your muscle setting exercises, is your gluteal setting. So, I'm gonna name ang potential setting. So, anyone from the group, paano ni Obrahon? Aside sa mga nakahambal na, pwede iba naman. Sige, from the group, malawag ko. Okay. Ma'am Shane Palomar. Ma'am Shane.
Hello, Miss.
Sige. Ma'am Shane, good morning. Sige. Paano mani-ubrahon ng inyong gluteal settings? Ma'am Shane. Yeah. Anyone makahelp?
Permission to speak, Miss.
Go. Go,
Matry
sir.
lang ako. You put the patient, Miss, on prone, and then ipalpate mo ang top of the glutes, and then you ask the patient to squeeze her butt as tight as you can.
Okay. So, yes, you ask the patient to prone, pwede, and then you ask the patient to contract both gluteal muscles, like, ipa-imagine mo siya, nangyara nga one kasi point, or in between sa iyang buttocks, and then itry niya na i-squeeze into mat, and then i-hold niya na for 6 seconds with 10 repetitions. So, as a PT, paano mo mabalan na sakto ang ginuubra ni patient? So, Ma'am Karina Ibanez. Oh.
For me, Miss, mabalaan mo if nag-check pinay mo sa patient if there is evident if there is evident contraction of your gluteal muscles and if so I'm not sure, Miss, pero
Sige. Medyo siya, no? Medyo masalan siya siguro kaya tungkol siya sa buttocks. Pero you could ask permission ng yapon sa patient. You ask the permission to palpate ng yapon ng iyang buttocks. Probably ang sa side lang, which is your gluteus medius. Pwede mo na siya, once na-contract na ng buttocks, do-contract mo na siya. Okay, hindi ka na siya kasama isolated. So, pwede ka na ipalpate ang atong gluteus medius, and then while you na hold yun ang position, and then hold for 6 seconds, and then repeat for 10 repetitions. Okay? So, most important kit ang mag-ask sang permission sa inyong patient na ikaptan nyo ang mga muscles or ikaptan nyo sila. Okay? Sige. May questions pa?
Hello, Miss. Yes, Miss.
Excellent. Si Ma'am Hansel?
Yes, Miss. Makot na ko, Miss, kung pwede man siya, di ba, Miss, maubrain sa pine position, Miss?
Pwede. Yes, pwede good.
Okay.
Pwede mo siya pa-overhaul yung supine. For example, kung budlagan si patient mag-prone, kung for example, ano siya, geriatric siya nga patient, no, or probably may budlagan siya maghapa, pwede mo siya overhaul yung supine, pero make sure get to palpate ang muscle sa kilid, your meatus while contracting. Okay? Sino pa?
Thank you, Miss.
Okay. Yes?
Usually, miss, kung sa inyo, wala miss, ano ang usual na position for the patient?
Okay, review what? Miss Karina?
Ang for example, sa gluteal settings, wala miss, di ba
Oo.
pwede siya na-prone, pwede siya supine?
Yes, pwede siya prone or
Pero ano din miss, ang ginahimo sa rehab miss?
So kung mainly, kung pwede siya ka-prone, I suggest prone. Okay? Pero kung given ang iyang na problema nga hindi siya kakapa, okay, for example, di sa inyong clinical exercise later on or exam, kung ang patient niyo si mama niyo or si papa niyo, probably budlayan siya magkapa, I suggest supine na lang. Okay? Any questions pa?
Thank you.
Okay, no problem. Sige. So, I'll proceed na ha. Okay. Lapit ka na ito matapos. Okay, for shoulder stabilization exercises and also for your shoulder multiple angle isometrics, which will be included sa inyong clinical examination. These two types of exercises, ipakita ko sa inyo, ihatag ko sa inyo ang video. Okay, just to clarify things, shoulder rhythmic stabilization, gahatag ka man yapon, some resistance, so also with multiple angle isometrics. So I suggest when you do your shoulder multiple angle isometrics, I suggest mga 4 lang ka-angle. Like, start ka with 30, tapos next is 60, tapos amat-amat ka naman decrease. Mga 4 to 6 lang na angle ang inyong ipataas. Hindi na every 10 degrees increase ka, change ka naman, 10, 20, 30. It's very, very tiring siya sa patient. Okay? Estimate nyo lang. Hindi man na all the time na ma-measure natin bala ang angle na gina-increase natin. So, like in multiple angle isometrics, kamo estimate kung pila sa change ang angle ang obrahon nyo. Probably mga 4 to 6 lang. Hindi nyo na po kasobrahan. Okay? Kay tiring na siya katama. Okay? So, pakita ko na lang ang video. Sige. So, guys, so just to clarify things, you have to review sa inyong proper hand positions when you do your shoulder stabilization and also your multiple angle isometrics. So you have to review kung diin ka ma-stabilize, diin ka ma-heart resistance. Okay? So very important ang proper hand positioning when it comes to shoulder isometrics. Okay? You have to position sa patient kung diin niya mas ma-execute ang proper nga resistance against sa PT nga force as well man. Dapat convenient man siya sa PT na malabot naman ng patient bala nga makahatag siya sa proper na resistance sa force ng patient. Okay? May questions pa?
Yes, miss. May mangkot ng kota ni miss.
Sige. Mauna na si Miss Handel. Yeah, go. Chan.
Miss, mangkot ko bala miss sa shoulder rhythmic stab. Amo to siyang sa first part, miss, no?
Yes, that is your shoulder stabilization.
So, bali, miss, ano mo nga posisyon kung naghihigda, do ara lang gid sa babaw, ga point, amo lang gid na, miss, tapos
So, bali, kumbaga, ang ginhatag ko lang to siya, ginhatag lang to siya naman na 90 degrees. So, pwede kahatag, ang, for example, ang makaya lang ni patient is 60 degrees lang eh. So, start ka lang sa 60 degrees. So, kanina, is kin-90 ko lang, kaya mo na siyang given. So, bali given na siya ang 90 degrees, given na siya ang 60 degrees. Depende sa makaya sa patient. Okay? So, start ka with 90 degrees and then butang ka resistance. So, bali mo brown stabilization exercises is perturbations lang. Quick release, lain-lain nga direction. Okay? So, focus na naman ang shoulder kay kung ubuson tanan nga muscle, medyo madugayan dito kita siguro. So, just for the shoulder nga mga nga stabilization exercise, amo na siya itong ginaubra. So, ang perturbation, pwede ka ubra up to 90 perturbations lang. After 20 lang, 20 perturbations. Then, lain nga direction. Okay? Kuha mo.
Yes.
Yeah.
Yes, miss. Pero sa perturbation wala, miss, di ba hamba mo, miss, pwede naka 90 degrees. Ga-progress man na, miss, sa shoulder stab. Na
Yes.
lain, miss, nga
Pero,
ang
kung for example, ang nakuha mo, sa clinical exam mo is shoulder stabilization, tapos given with an angle of 90 degrees. So, ang malang na-ubrawan mo. Within 90 degrees and then 20 repetitions nga perturbations and then relax. Okay?
miss, last na lang, miss.
Okay.
Bali sa patients, pala miss sa rehab, mag-prescribe di miss ang physiatrist sa PT management sa shoulder stab. Immediate na dahil miss nga 90 degrees ang i-position sa patient or naka-specify miss sa
Kaya nga po.
naka-specify miss kung
Or, depende nga, ang doktor na mahambal sa PT to assess ang range of motion sang pasyente and then, ikaw mismo ang mahatag sang range or angle. Okay?
Okay, miss. Thank you, miss.
Okay. Sino pa? Ma'am Lassie? Miss Lassie?
Ma-ask bang ko tani, miss, for gluteal setting kagina. So, diba miss yan for so,
Come again, medyo choppy. Sorry again.
sa gluteal setting, bala miss kagina, diba, ang patient pwede siya ka-prone or ka-supine. Pero gina-instruct man na sila miss nga i-bend ang ilang knees kung matigas sila sa prone or supine or straighten lang ilang lower
Kung
siya
mag-bend your gluteal settings.
or straighten.
So, kung gluteal settings, as much as possible, wala man wala man effect siya sa tuhod. So, I suggest, na lang, straighten nyo na lang. Kaya since ang function or ang inyong actions, ang inyong gluteals is, i-help mo siya slight na extend sa inyong hip. So, I suggest, ipa-straighten nyo na lang iyang supine. Full supine niya siya. Okay? So, para mas maka-actmayo ang inyong gluteal muscles. Okay?
Thank you, Miss.
Okay, no problem. Sino pa? Sige, just one last question. Ano ang kinanglan nyo nga i-consider when it comes to isometric exercises? Ano ang contraindication or precautionary measure na kinanglan natin i-consider? Good. If si patient, may history sa what? Guys, huwag daw.
Yes. Kung may siyang cardiovascular problem.
Yes, good. Oo, tama. So, you have to ask the patient kid na mag-count kay more likely gabal salva sila kay, diba, gina-resist nila ang movement or ang force ng PT for about 6 seconds. So, muna na sila iban. So, you have to ask the patient to count. So, initiate ka mga ma'am, sir, pwede ka count para hindi ka mamuna and para hindi magtaas yung blood pressure. Okay? Sige. So, actually, amo naman lang natin na topic. So, may pahabol na questions?
Miss, pwede ka ask?
Yeah.
Miss,
Sure.
is there any chance na mapalaan naman, Miss, kung ano ang others na i-include ni Sir sa pracs?
Okay. So, ako lang na. So, focus kami kung isometric exercises, amugin na siya. So, na siya, naka-fix na siya actually. Though, hatagan na kamo naman isang PT management. So, kamo na bahala kung paano nyo pasunuran. So, with the neck, I think, upod sang practicals nga under sakon is ang neck. Ang palay exercises. Tama. And then, upod pagin ang isometrics. And also, ang last, basta, may na siya, do parehos man sa iban is may case. Oo, so may case ka magyapon. So, just, quick review lang kamo sa iban ng mga cases. Okay? Pero mga rare ng mga nakatabo is no treatment. Hindi siya parehos. For example, sa inyo ba lang practical sa school na may mga contraindication kami ginahatag and then cancel ang inyong treatment. So, probably, ubrahan niyo din siya. So, start ka mo review. Hatag ko niyo ako na video para tunan niyo. Learn niyo good ang proper hand placement. Ask for permission to palpate and also proper positioning sa patient. So, I suggest you guys na kung mag-ubra ka mo or mag-treat ka mo sa patient niyo, ang permit ko na ginahambal sa ako ng mga interns na one position, ubrahon tanan nga exercise, and then transfer ka naman sa ibang position. Okay? Para hindi awat sa pasyente. Kaya let's just say nga si patient in pain na siya. So kung pabalik-balik ka mo, nga ginapumpo mo siya, tapos higdaon niyo naman siya, tapos pumpo niyo naman siya liwat, so mabudlayan na si patient. So I suggest guys, one position, do all exercises, and then transfer sa another position. Okay? Any questions? Okay. So, that's all for today. Review ka mo, kulat ka mo, or ask nyo ang inyong CI kung when ka mo next practical sa ila. So, wait for your schedules na. So, thank you so much, and hopefully, mina-learn ka mo. Okay?
Thank you, Miss.
Bye-bye.
Thank you, Miss.
Thank you, Miss. Thank you.